Hi everyone, this is Priya Basil and today I'm going to discuss one of the NCLEX type question, and I will be teaching you how to use your application and critical thinking when you're analyzing your question. So let's begin with the question here. So the question is, what is the best position for total hip replacement patient? So the key word here is total hip replacement patient and the best position. And they're saying, what is the best position? So if you know this, then you know how to implement your intervention and how to pick the best answer. So what is hip replacement? The patient, anytime when they're going with a history of fracture and it's not getting a proper fixation, or severe arthritis, or patient has severe rheumatoid arthritis or osteoporosis, then doctor is sometime recommending the patient to go for hip replacement. So as a nurse, your most important thing for a patient with the hip replacement will be always make sure that you're providing an abduction position. So what is this abduction position? Keep two pillow in between the leg and provide the abduction position and neutral rotation. Prevent the external rotation. And you have to always make sure that you are telling the patient always be on the supine position and keep two pillow or one pillow as recommended by the doctor to provide this abduction position. Avoid the adduction. If you do adduction, if you provide the adduction, then what will happen is it's going to lead to dislocation. So what is abduction or adduction? Abduction means away from the body. Adduction means towards the body. So let's see what are the options we have here. Option A, abduction and neutral rotation. I can say that this is the right answer, this is the best answer, because once you know what's the best, you don't need to really puzzling with the other option, but we have to see if we have something better than that. But I don't think so anything we have better than this. Number B, abduction and neutral rotation. Of course, abduction is okay, neutral rotation is okay. Sorry, I read wrongly. It's not abduction, it's adduction. So adduction is add, which we have to avoid. So that's totally wrong. We have to immediately eliminate that option. Then the third one is abduction and internal rotation. So of course, abduction is okay, but internal rotation is wrong. We have to eliminate that part. The fourth, the D option, adduction, which is wrong, and external rotation, which is also wrong. So here when we are looking into B, C, D, all of them are wrong, but we have the best answer for the question, which is abduction and neutral rotation. So anytime when you're dealing with a hip replacement patient, you should know what is the best position, what position need to be avoided. So we know that abduction is the best position, and how you provide the abduction, keep two pillow in between the leg and maintain the abduction and neutral rotation. And then how you have to prevent the external rotation, always use the two truncaster roll in between the leg and you are maintaining the position and you are preventing from external or internal rotation. And always avoid adduction, because adduction can lead to dislocation further. So you have to always avoid that, but you have to maintain abduction and neutral rotation. So that's about this question. Always when you're doing an NCLEX type question, always you have to make sure, especially for the multiple choice question, look for the keyword. And keyword is something very important. It's always matter how you read a question also. So sometimes when you're reading a question, you can easily analyze that, help you to analyze a question. So here they're saying, what is the best position for total hip replacement? And best is the best. Nothing can beat that option. So we have the best option, which is A, abduction and neutral rotation. So we have the best answer, and A will be the best answer for this question. So that's all for today, and I'm going to bring another question, and then I will be teaching you again how to analyze, how to use your application, how to use your critical thinking so you can pass your NCLEX exam in first attempt. That's something your target and my target as well for you. All the best.